Hi, good afternoon. My name is Midwife Pip and I'm really excited to be part of the Wellness Fest this Saturday. So fantastic. I've been trying to watch all different things, but I did finish a night shift this morning, so confession, I haven't watched everything, but I will definitely watch it back. So much information from so many different knowledgeable people, so it's an absolute privilege to be part of it. So I am this afternoon going to be talking about types of birth and birth interventions. And if you've got any questions, please just drop it in the comments box and I will try to answer as many of those as I can along the way. If for any reason I can't answer them or we run out of time, then please just head over to my Instagram page, midwife_pip, and comment or just send me a message and I'll try and cover that for you there. So let's get started. So with birth, I think there's definitely nothing more exciting than the birth of a newborn baby. And it's quite a unique thing because that's long been the case throughout kind of human history. However, medicine has advanced and childbirth options have developed to make birth a safer experience for both mothers and babies. And we know that unfortunately even the most planned births can have some twists and turns, so it's really useful, I think, to empower yourself with all types of birth, just so that you go into the experience informed. And it's really important, I think, for all mums and pregnant ladies to remember that you cannot fail at labour or birth. Birth is beautiful and it's equally momentous, whichever form it might take. And the kind of take-home note, I guess, from my chat today hopefully will be that women should be able to give birth in an informed and safe way that is free from kind of any fear or mystery. So I'm really excited to be able to share information around birth interventions and types of birth today. And as I said, pop your questions in and I will try to answer them as we go along. So I'm going to start with a ventouse birth. Now this is sometimes called a kiwi or a suction cup, and it's where your baby is still born vaginally, but an obstetrician provides some assistance. So for a ventouse birth, your baby's heartbeat would need to be continuously monitored, and it's usually done in the labour ward room, and you will be positioned into a position called lithotomy. So that's where your legs go up into some little stirrups to support them. And there'll usually be a paediatrician, so a baby doctor, also present in the room. And what happens is like a round plastic or metal cup is applied to your baby's head using some suction. And when you have a contraction, you'll be encouraged to still push like you will have been at this stage. And the obstetrician will gently provide some pulling traction to help get your baby's head out. And our kind of birth canals are like a U shape, so it's almost like lifting them just round that little corner of the U shape so that your babies can be born. Now for this type of birth, you might require something called an episiotomy. So that's a cut that's done on the perineum, so the bit of tissue between the vagina and the anus, and that's to help prevent a tear that could extend into your anal sphincter muscles. And it also provides a little bit of extra space for your baby to be birthed. There'll be analgesia provided before this procedure is done, and there'll be dissolvable sutures popped in afterwards. Now, reasons for the need to perform a ventouse birth are plentiful. Some of them include your baby being very close to being born, but just needing a little bit of a kind of a speeding up. So if there's concerns about your baby's heartbeat, or you've just become absolutely exhausted in that pushing stage. It can sometimes leave a little circular mark on your baby's head, but that usually disappears within about 48 hours. And in some babies, about 1 to 12 in 100, they'll have something called a cephal hematoma, which is like a bruise on your baby's head. It usually doesn't cause any further problems. Sometimes it can cause a little rise in jaundice in the first couple of days, but usually it will just disperse without any problems. But your baby will be monitored if we suspect that this injury's occurred. And then I suppose the kind of next step in intervention for birth is something called a forceps birth. Now, like with the ventouse birth, your baby's heartbeat will still be monitored continuously. We'd still encourage that lithotomy position and a paediatric doctor would still be present. All right. An obstetrician will usually ask to perform a vaginal examination to ensure that your cervix is completely dilated and also to check the position that your baby is in. A forceps birth could take place in the room depending on what position your baby was in and how low your baby was, but often it's performed in the theatres on a labour ward. Now, there's good reason for this, and sometimes you might hear it called a trial of forceps delivery. And what this means is that we're going to try to deliver your baby via forceps, but if for any reason this isn't possible or it doesn't work, we're then in a safe environment with all the people there that we need to proceed to a caesarean section. So it means that there's kind of no delay if we feel that we need to take another step. Now, a forceps birth does require adequate analgesia because two sort of metal spoon-like instruments are inserted into the vagina and they carefully fit around your baby's head and then join together at the handles. Now, if you already have an epidural on board, this might be sufficient, or it might be topped up a little bit by the anaesthetist. If you don't have an epidural on board, then you'll likely be taken to theatre and have a spinal anaesthetic so that you don't feel any pain during the forceps birth. You'll still be encouraged to push when you have your contractions, and the obstetrician will gently again pull the other end as you push to help with your baby's birth. With a forceps delivery, it would be recommended again that you have that episiotomy to reduce the risk of tears to the anal sphincter. Now, indications for a forceps birth kind of mirror that of the ventouse birth, but one addition is that your baby might be in a slightly awkward or suboptimal position that makes the ventouse birth not possible. Forceps can leave some superficial marks on your baby's face or head, but they do usually fade within 48 hours. About 1 in 10 babies may have some small cuts on their scalp or face, but again, these will usually heal pretty quickly. And then the kind of next sort of birth intervention that we hear about is a caesarean section. Now, this can be performed either as an elective procedure or in an emergency. It's an operation and a cut is made just below your bikini line, so around 10 to 20 centimetres long, and your baby is born out of this incision. The whole procedure varies in length, but as an average for something that's routine would take about 45 minutes. And around 25% of women in the UK will have their babies via a caesarean section. So this is why it's really important that we kind of inform ourselves about all the potential kind of birth outcomes. Now, there's lots of indications for a caesarean section being recommended for the birth of your baby, and some of those will include a breech presentation, so where baby's bottom first, where your placenta is lying too low, certain infections or concerns over your baby's heartbeat. Some women may also choose to have a caesarean section, so if they have got something called tocophobia or where they've had a previous caesarean section. You will require a cannula in your hand, so a little plastic tube, or in your arm, and that's for the administration of medication during the procedure. And a catheter will also be inserted. Now, this is to make sure that your bladder is empty during the procedure, to ensure that we reduce the risk of causing any damage or injury to your bladder. And this will be left in for a little time afterwards because you won't be able to move around and mobilise or have the urge to pass urine. Now, a caesarean section is always performed in a theatre, and sometimes there's quite a few people present, which can be a little bit overwhelming. Now, there's lots of individuals. There'll be an anaesthetic doctor who's in charge of managing your airway, ensuring that you are pain-free, and they will have an assistant with them. You'll also have 2 surgeons, a midwife, a baby doctor, and someone running some equipment in and out. And sometimes that feels like quite a lot of people when you're in the centre of the room. But it's important to remember they've all got a role to play and they're all there to keep you and your baby safe. Now, usually you'll be awake during this procedure by either an epidural top-up or a spinal anaesthetic to keep you comfortable. And therefore your partner would be able to accompany you into theatre in most cases. However, sometimes we have to convert to a general anaesthetic, and that's where you'll be put to sleep for the procedure. In these circumstances, your partner wouldn't be able to accompany you into theatre. Now, if your baby is born in good condition and you're awake, then you can still have delayed cord clamping and skin-to-skin in theatre, so these things can still be facilitated. The recovery period for a caesarean section is slightly longer than that of a vaginal birth, and hospital stay is usually kind of 2 to 4 days depending on the circumstances that surround your caesarean section. And as with any operation, there's always risks associated to things like bleeding, infection, or damage to nearby structures. And your obstetrician will discuss all of these risks with you prior to you consenting for a caesarean section. And I'm just going to touch a little bit more about the episiotomy that we discussed with the ventouse or forceps birth. Sometimes episiotomy is an intervention that is done without the use of instruments as well in facilitating a spontaneous vaginal birth. Now, the idea is that it opens the vagina up a little bit more, which allows the baby to come through a little bit more easily. And around 85% of women will sustain some degree of perineal trauma during childbirth, be that via episiotomy or via natural tearing methods. Episiotomies aren't performed routinely in England. They're only done to either help prevent a severe tear or help to speed up the birth of a baby if we feel your baby needs to be born a little bit quicker. And these are always recommended to have repair afterwards. Regional, so analgesia will be provided, so local anaesthetic if needed, to make sure you're comfortable during the repair. And dissolvable stitches are almost always used so that you don't have to have sutures removed from that sensitive area afterwards. And for most women, the perineal area heals really well. It's a very vascular area, so keeping it clean and dry to reduce the risk of infection, and it will then heal really, really well. So hopefully that's given you a little bit of information about kind of potential modes of birth and birth interventions, and hopefully it'll help you to feel a little bit more reassured and a little bit more informed going through your birth journey. Most ladies will plan for an uncomplicated, spontaneous vaginal birth without any assistance, and that's what the team around you will be trying to support you to achieve. But it's useful just to have a little bit of understanding of some of the events that might occur and take place, so that if you are in that situation, it's not a complete minefield and a complete shock, because it is quite difficult to rationally process all the information that's being provided to you in sometimes a slightly rushed and a very emotive circumstance. So I hope that's helped to inform you a little bit more. As I say, if you have any questions or queries, please feel free to head over to my page, midwife_pip, where there's loads of information on my wall, but I'll also happily answer any kind of questions that you might have. And just a little leaving note is for all mums-to-be or pregnant ladies, just to remember that you cannot fail at labour or birth. It is your baby, your birth and your experience, and no matter how it happens, you're doing an amazing job. So take care, lovely to chat to you all today and be part of the Wellness Fest, and I hope you have a great Saturday. Take care, bye bye.